Hi, good evening to Dr. Mahathir and to my fellow friends. Today we are going to present about acute myeloid leukemia. Before we start to present, we would like to introduce ourselves. My name is Khausi Devi, Daughter of Ravichandran, and my friend here is Sidarasu Analaki Subramaniam. We are from first Bachelor Biomedical Science. Today I'm going to talk about acute myeloid leukemia for the introduction. Acute myeloid leukemia is a type of cancer which the bone marrow will make a large number of abnormal blood cells. Leukemia will affect red blood cells, white blood cells, and platelets, which called erythrocyte, um, leukocyte, and platelets. It is called for a type of fast-growing cancer, which is called a type of immature white blood cells that may found in the bone marrow and blood. Next, it is also characterized by the rapid growth of abnormal cells that build up in the bone marrow and blood and interfere with normal cell production. It also may spread may occur for the brain, skin, or gums. Besides that, it is also progress rapidly and it is also typically fatal within weeks or months if let's say we never left it untreated. This is the picture of AML. Okay, for the epidemiology of AML, the number of new cases among men and women per year is 4.2 per 100,000 population. The incidence is over 20,000 cases per year in the United States. The average age of the time of diagnosis is about 65 years. It is also more prevalent about non-Hispanic whites. Next, the causes and risk factors. It may also get older. Being male due to ML is more common in the males than in the females. Chemical exposure reason is a solvent that used in the rubber industry, oil reference, chemical plants, shoes manufacturing, and cigarette smoke, and the motor vehicle exert with the some grease cleaning. It is also drugs called alkylating agents are linked to increase the AML, certain blood disorder, and family history. Diagnosis clinical presentation. Due to lack of neutrophils, interest, increased bleeding secondary of platelet deficiency, bleeding due to minor trauma, bleeding of the gums, fetish, which is small purplish spots caused by intradermal bleeding, fatigue, loss of energy, and shortness of breath upon exertion for the due low red blood cell count. This is the diagnostic when the patient come for the treatment for the AML, when we usually run in the lab. For the diagnostic lab test, for example, for the bone marrow biopsy and aspiration, the removal of the bone marrow blood and bone will be looked at by the pathologist under the microscope of signs of cancer. Immunophenotyping, it is the process used to determine the subtype of AML by comparing the cancer cells to normal cells in the immune system. Next, beside that, there is also blood test. Test blood test is also for the patients with AML, with commonly reveal increased leukocyte count initially with excessive immature cells as well as the low red blood cell and platelet counts. Causes of AML: smoking, chemical exposure, cancer treatment, radiation exposure, blood disorders, which is called plethyscythemia, essential thrombocythemia, and idiopathic myelofibrosis. Treatment. There is also two passes of treatment for the AML. For example, remission induction therapy. This is also first pass of treatment. The goal is to kill the leukemia cells in the blood and the bone marrow. Next, post-remission therapy. This is the second pass of the treatment. It begins after the leukemia is in the remission. Other treatment. Other treatment for the AML example is chemotherapy, radiation therapy, chemotherapy with stem cell transplant, targeted therapy, and other drug therapy. Next, my friend Arun will My friend Sitarasu Arun will present about the pathophysiology.
Okay, my name is Joseph. I want to explain about the pathophysiology. Okay, the pathophysiology is similar to the acute lymphoblastic leukemia, and acute myeloid leukemia is caused by the series of acquired genetic aberration. Malignant transformation usually occur at the polypotent stem cell level, although in sometimes involved as a committed stem cell with a more limited capacity for self-renewal. Abnormal proliferations, corneal expansion, aberrant differential damage by all apoptosis programmed with the cell death lead, that leads to the replacement of the normal birth element with the malignant cells. Next slide. This is the acute myeloid leukemia. Overall, the pathogenesis and the clinical presentations. So the first is the accumulation of the genetic abnormalities in the original myeloid precursor cell, normally called blast. And then the neoplastic myeloid precursor cells, blast divide and accumulate in the bone marrow. And aberrations of the basic displaced other blood cells precursor from the bone marrow inhibit their development and differential after the neoplastic blasts fill up with the bone marrow and this spill out in the blood. And lastly is a high turnover of these cancerous cells. And the second is we see the mechanism. The multifunctional causes most with the unclear mechanism and expanding bone marrow pushing on the blood, on the bone. And finally for the cytopenia on the full blood count and 20% lower of the bone marrow is a blast on the bone marrow is spread and biopsy. Blasts are detected as the white blood cells on CBC and neoplastic cell may secrete the excessive amount of the coagulation promoting the cytokine into a circulation, but it doesn't always happen. It's rare. And myeloid cells normally produce the intracellular granules which participate in the immature blood cell from the root, but could not doesn't happen. It's caused by the high rate of the sialysis. For the complications and for the symptom, sign and symptom and lab finding for the weight loss happens, malaise and fever, chills, night sweat, bone pain. The neutrophil will be low, RBC will be low, the platelet reduce the blood clotting ability. It also may cause the leukocytosis despite in the pancytopenia. Disseminated intravascular coagulations happens, and the peripheral blood smear we can observe the aurorod cells. For the biochemistry, release of the intracellular content such as uric acid, potassium, and LDH into the plasma. And finally, for the complications, the greatest chance of the infection is anemia, fatigue, shortness of breath, easy bruising, and panchasia on the skin, and high RIN and PTT and low fibrinogens. For for the biochemistry, they can detect the hyperuricemia and hypercalcemia and high LDH. For the notes, for the key point, mostly acute myeloid leukemia makes 80 to 90% of the acute leukemias is usually happens for the older people, and acute myeloid leukemia present with more rapid disease progression than the CML, which is chronic myeloid leukemia. For the next slide, I will talk about the prolongs. Okay, the prognosis depends on the age of the person. The age might be older, may link to lower recurrence rate and more complications. Whether the leukemia has spread on to the central nervous system, whether the patient has a systemic infection at the time of diagnosis, whether the patient has a very high blood cell count time of the diagnosis, they have a subtype of AML, whether the patient receives the chemotherapy and radiation therapy in the past to treat the different cancer, whether the patient history of the blood disorder such as myelodysplastic syndrome, whether the cancer has been treated before the recurrent, which means come back. So next slide will be prevention. For now, acute leukemia, there is no prevention, but we have to avoid the tobacco exposure of pesticide or industrial chemical may help, which means we have to avoid any chemical that affect our genetic DNA. So then will be next. will be the current research. The new drug for the current based on the current research, the new drug has produced a complete response in the patient with the acute myeloid leukemia. There are some new drugs for the encouragement treatment, modelization reported as the ASH for the leukemia, such as uh, treatment mean inhibitor, which could be the next class of drug if you to treat some of form of acute myeloid leukemia. So they show the mean inhibitor that can cure the disappearance of the leukemia and restoration of normal blood cell function for the treatment. They have a proof for the ALS Supporter Foundation research by the Dr. Jonathan Crewin from the University of Michigan into the role of Mayhem start over the 15 years ago today. Now they will update for the futures. This from the current research. So I will go to the next slide. For the conclusion is acute. Acute means a very fast progression for the blood cancer happen in the bone marrow. The most common type of acute leukemia is it happens mostly in adults. So this type of cancer usually get more worsen quickly in its if not treated and can be fatal. AML also called the acute myelogenous leukemia and acute non-lymphatic leukemia because it's not involved in the lymphatic passage. For the encouragement for the new modulation of the treatment, main inhibitors such as rimonabant and Zifron has been proven its appearance of the leukemia and restoration of normal blood acute leukemia for the patient. So the conclusion is they have for the happen they have some drug can be possible can be cured. So this my presentation of the acute myeloid leukemia. So thank you for all of you for listening. So,
Thank you
yeah.
too.